Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative, Orthopedics, and Sports Medicine.
I'm here at Regenerative Orthopedics and Sports Medicine with Dr. Ferrell once again to talk about osteoarthritis. First of all, thank you so much for having me this morning.
No, thank you for coming.
So let's get into it. What is osteoarthritis?
Yeah, so with arthritis, we have osteoarthritis and rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition. Osteoarthritis is normal wear and tear as we get older. Just as we get a little bit of gray hair, we get older, our joints start to wear and tear, and that gives us stiffness, achiness, pain in our joints. It slows you down. It makes it difficult to go up and down stairs. And so these are things that just happen as we get older.
I feel like a lot of people think that they're just getting older, but really, this is diagnosable, it's treatable. What kind of treatments do we see right now for osteoarthritis?
Yeah, so most people, when they think of osteoarthritis, they only think of the classical things, right?
Mm-hmm.
I can get a cortisone shot or I can have surgery, right? And, I'm stuck in this treatment gap for years before I really want to do something like a major surgery. When in actuality, we have a lot of regenerative treatments that can slow the progression of the arthritis. It can decrease your pain, increase your range of motion, and improve your function in a very minimally invasive way.
Tell me more about the non-surgical options that you guys have at ROSM.
Absolutely. So some of the things that we use to treat arthritis with are platelet-rich plasma, especially for mild to moderate arthritis. But if you have more severe arthritis, we use things like cells from your fat or cells from your bone marrow, which can actually take people that have severe arthritis, decrease their pain, allow them to be more active, and kind of get their life back.
Absolutely. I think the work that you guys are doing here, it's really life-changing. And going the non-surgical route is always better, right?
Well, it's going to be less invasive.
Yeah.
There's no anesthesia risk that you have to worry about. And we're not cutting you open and putting metal in you. So when we can kind of get you back using your own cells to decrease the pain, and actually, if we can actually get you even earlier, we can actually prevent it from getting so far gone where you don't need these things.
So a big question here is, a lot of people go to surgery and they're like, oh, it's a quick fix. But how long does the non-surgical option take in the treatments that you guys have here?
Yeah, so after a treatment, people can notice improvement within 4 to 6 weeks.
Oh, that's that fast.
Yep, and they'll probably get maximal improvement somewhere between 4 to 6 months. And depending on which treatment we choose, something like PRP can give you benefit for 1 to 3 years. And if we use cells from your fat or your bone marrow, we can get benefit from 3 to 5 years.
Wow.
And these can be repeated.
It really, it changes someone's life. They might be watching and they don't know that they have a problem. You guys come in, get evaluated, get help. It could completely change someone's life. So for people watching right now, what advice would you give them if they're suffering from, pain going up and down stairs like you mentioned?
Yeah, if you have pain, don't be afraid to kind of come in and get things checked out, right? We take most major insurances, so you can have an evaluation done, you can have an ultrasound done in person. We take 30 minutes with our patients, so we give them a lot of time, and we can go through all of the different options to see if this is a good option for you.
And you guys have locations all over the DMV. So if people want to reach out, learn more, where can they go for more information?
Yeah, reaching out to our website, rosm.org. They can also get to our YouTube page from there also. They can get plenty of information between those two resources, and then give us a call and come on in, and we'll take great care of you.
Thank you so much, Dr. Ferrell.
Thanks for coming.
My pleasure.